Hi, in this video we are going to look at doing some single leg loading. So bringing ourselves over onto one leg. If you're working on some rehab from any kind of foot or ankle or knee or hip injuries, then doing some work on one leg is really important. So we come into a single leg stand first. Just check the position of your foot. Try and make sure you're slightly drawing up through the arch, pressing down through the big toe. Keeping the other leg lifted, arms out to the side. And from here, we're just going to bend the knee. Okay, so have a sense of lift, drawing up through the arch, up through the center of the pelvis, through the pelvic floor, and then bend the knee. So we're going to come straight down, trying to maintain the position of the knee over the middle of the foot. So kind of over almost the second toe, perhaps the third toe. Coming down as far as feels okay. So your heel is still on the ground. And you're just taking note of the position of the knee and also position of the pelvis. So what may happen as you bend the knee, if you're not looking down, is it may drop in like this. The pelvis may drop to the side like this. And so that's what happens if the glutes aren't doing their job as well as they could be. All right, so if that's happening, come back up and then just do a much smaller bend of the knee. Okay, so you're just going down a tiny bit, almost feeling like you're kind of screwing your foot down into the ground. And the knee is over the middle still, but it's almost kind of working out towards the edge. Coming down and coming up. Okay, keeping the chest lifted, down and up. Feeling like you're really working through the foot as you do this. That the outside and the inside of the foot are both rooted down onto the ground and through the heel as well. So this single knee bend exercise, you can probably do 8 to 10, perhaps even up to 15. Go with what feels like the right amount for you. So going until you feel fatigue. And that fatigue it doesn't have to be complete failure. That fatigue is just when you become less able to maintain that form. So less able to maintain knee over the center of the foot, less able to maintain upright rib cage stacked on top of the pelvis. Okay. Have a rest, shake your leg out, and then same thing. So 3 sets of somewhere between 8 and 15, enough to give you a little bit of a sense of fatigue, but not so much that you can't maintain your form. And that's the kind of thing that you could do 3 or 4 times a week to strengthen up through your glutes, improve your proprioception, improve your control through your hip, your knee, and your ankle. Work on your foot intrinsic muscles as well at the same time if you're doing it without shoes on. Good luck.